Hi, this is Dr. Habib. If we did what every other doctor does, we can't expect better results. That's the difference between Next Health. We decided to rethink medicine because the way the disease model is right now, it's broken. If we wait for the disease and we go on medication, that means a lifelong medical treatment. However, what happens if you stop the blood pressure pill? Does the blood pressure stay down? What happens if you stop the diabetic pill, the blood sugar pill? Does the sugar stay normal? And what happens if you stop the cholesterol pill? That's the problem. What we are doing is redefining the way we think about medicine, so we call that rethink medicine. And in order to rethink medicine, we have to do something different. So we like to predict disease, prevent them, and prolong life. That's the way the Next Health rethink medicine is all about. However, through rethinking medicine, we've now been able to achieve certain goals, which we believe is redefining the word treatment. The regular doctor thinks that by giving the cholesterol pill, they really are treating it. They think they are treating the lupus when they use the biological agent. The problem is when you stop the medication, the disease is still there. That to me needs to be redefined. At Next Health, the redefinition of treatment should be to at least try to cure it, and if not, to get as far into making it as normal as possible. So from a disease model, mere absence of disease doesn't make the person normal. Why? Because disease doesn't happen overnight. It's a process, and over time, the function goes down. And instead of being reactive, being proactive, understanding, having special tools to be able to evaluate how the function is coming down. Because most diseases are age-related diseases, whether it's arthritis, whether it's dementia, type 2 diabetes, whether it's neurodegenerative, like Parkinson's, whether you have osteoporosis. These are all age-related diseases, and this is the new paradigm in medical care. Not to wait for the disease, have somebody like Next Health identify the functional capacity, have a new way of assessment where the function going down is part of the warning. Don't wait until you are pre-diabetic. Don't wait until you're borderline blood pressure, because those parameters that we're using right now are for disease, and by assessing the pre-diabetes, the borderline blood pressure, you've actually resigned yourself to inevitably getting the disease. The only way is to have what we have, which is diversity of functional testing, to look at the function of the brain, look at the function of the heart and the blood vessels, looking at the function of the liver and its ability to detoxify, as well as the gut function, immune function, and hormonal function. These are all part of our executive physical, where all the different pieces of the puzzle are evaluated at the same time, so we can get an assessment of each and every organ system's function. Ultimately, what you're trying to do is protect your DNA, because once the DNA is engaged and it expresses disease, it's really a slippery slope down. And that's why no matter what we do at Next Health, whether it's our advanced testing, at the root of it, we have to find the things that actually cause premature aging, which actually also alters genetic expression. So as you know, high sugar will be detrimental to your health. It alters genetic expression and is part of the aging. Inflammation will alter genetic expression and is part of the aging process, which we call inflammaging. Very simple. Inflammation, aging, inflammaging. Literally, oxidation from your saturated fats, lack of exercise, stress, lack of sleep, as well as things that we know of like homocysteine. So these are the factors that we need to understand. But there are three things that you have to do before you can ultimately regenerate, right? Regenerating the ligaments and cartilage, particularly cartilage for degenerative disease like arthritis. If you want to regenerate the brain so that your brain function is optimal capacity, as well as if you want to reverse cognitive decline, if you want to regenerate, make those blood vessels more elastic and more functional, allow you to perform better, whether it's your blood vessels or the muscles. These are all part of the regenerative techniques. At the root of it is mitochondrial function. The mitochondria is not only the fuel, but even your hormones are made through the mitochondria. The mitochondria is involved in not only the production, the function, but also the health of the organ. Did you know that when you have fatty liver, the shape of the mitochondria and the energy production is down? Did you know that the mitochondrial function in a demented brain is of low ATP, low energy, and the shape of the mitochondria is also altered? So the shape and the function and the energy produced at the root of any regeneration has to be mitochondrial function. But in order for that to work, you must have blood flow. That's a critical part of any organ to heal. Oxygen that's delivered through healthy blood vessels. And the third component is that for every organ, there has to be specific nutrients to allow that regeneration to take place. So we call those neurotropic for the brain. If you want your blood vessels to regrow, we need angiogenesis. These are all also controlled by genetic expression, the transcription, the genetic expression. And so at Next Health, what we've been able to do is have a protocol in order to achieve regeneration, is to prime the body so that we eliminate the toxins and replenish the nutrients that you need. Then we try to reset the body. So as I mentioned, if you have inflammation, you've got to turn it off. If you have oxidation, you have to reduce it. If you have toxins, you have to eliminate it. That's resetting it. But then you have to reprogramming. The reprogramming means that to activate certain longevity genes, to the genetic expressions that I was explaining. The FOXO gene helps with longevity. The sirtuin gene helps with longevity. But then again, the same kind of healthy lifestyle that we have been describing can also downregulate genes that are consistently seen in cancer patients as well. So this is the holy grail of modern medicine, to move away from the disease model to a proactive model that is more about making the body function better so you can ultimately regenerate. So no matter who you are, instead of waiting for the inevitable decline, stay functional with lifestyle like exercise, going to sleep on time, not putting bad food in, putting the good food in. But in medicine, we know that some people have genetic weaknesses. We know that they're going to be exposed because of their indiscretions, because when they're busy and snacking, and we know that people don't ultimately sleep adequately, certainly in the prime of their life, and then when they want it, maybe it's not happening as well. They don't supplement because they're never told or measured intracellular vitamin levels. So all those things need to be in place for us to prime the body, reset, so we can reprogram, and then we can regenerate through mitochondrial function, increased blood flow and oxygenation, as well as nutrients that each and every organ needs. And that's the Next Health way. So we harness all of these regenerative techniques, whether it's our PRP, platelet-rich plasma, which is then injected into degenerated joints in using combinations of things that actually temporarily injure the cartilage so that they can mount a regenerative response. That's how we also regenerate our immune system, how we regenerate through intravenous vitamin therapy. We can even stimulate gene expression and gene alteration by utilizing hyperbaric oxygen chambers. That can not only activate angiogenesis, new blood vessels, that can also reduce inflammation. It can actually detox the mitochondria, and then it's been shown to alter the genetic expression of up to almost 1,900 genes, of which 1,500 are about expressing, and about 400 to 500 is about down regulation or suppressing the oncogenic or the bad gene, should we say. And so really the summary is that we move from Next Health, rethinking medicine where we can predict, prevent, and prolong life, to a model where we're redefining what the word treatment means, which is more of a proactive instead of reactive. That means treatment means to either try to cure it or at the very least improve it, improve the function. And that what we do is done through assessing the individual markers for function and then making changes so ultimately you can actually regenerate the brain, you can regenerate your hormonal status, you can regenerate your immune status, your blood vessels, your liver, and so forth. And that's ultimately what we want. The new type of medicine is about rethinking and redefining medicine, and ultimately you want better performance, better brain performance, you want to think better, you want to be sharp, you have the energy, and so you can have better quality of life. It's not about just longevity, it's about the health span, so you can enjoy the long life that you may actually achieve through proactive care.